Good evening, everyone, and welcome to Locker Room 2.0. My name is Dr. Marlin from Black Creek Community Health Center. Tonight, we're honored to host another candid and real conversation with our community and health experts. We met here at the JCA 2 weeks ago to discuss issues that were important to the Black community and the Caribbean community. And we're back here tonight to continue the conversation. So welcome, everyone. Thank you to the community leaders for joining our clinicians to have an open discussion around sport play, the BIPAC community, and how COVID-19 vaccine plays out specifically in our Black community. We promise answers to your questions and concerns about COVID-19 vaccines, and we're here to get them. If you're not able to get all the questions, feel free to please email us at info@bcchc.com. Tonight, our panels are composed of experts from sports and health and all different aspects of our community. Thank you all for sharing your experiences and expertise in order to help the community we care so much about. Thank you to our hosts here at the Jamaican Canadian Association for generously welcoming us into your space. And thank you to Black Creek Community Health Center for organizing tonight's discussion and continuing this leadership in our community. We want to make some land acknowledgements. So before we begin, we want to acknowledge the heritage that underpins all the history of this country, our indigenous heritage. We are joining you today from traditional territory of the Wendat, the Haudenosaunee Confederacy, and the Anishinaabe, including the Chippewas and the Mississaugas of the credit. Today we are hosts of First Nations, Métis, and Inuit peoples. We share responsibility of those who use this land to share it peacefully and care for it. We acknowledge this responsibility and recognize the efforts of the nations in maintaining this land. We would also like to acknowledge our ancestors of African descent, particularly those who came here forcibly as a result of the transatlantic slave trade. Let us remember to honor our ancestors of African origin and descent. So, without further ado, let's introduce our esteemed panel this evening. Some of our panel members were here 2 weeks ago, and we have some new guests here tonight, and we invite them to say a few words. Joining us by video, we have Dr. Vinita Dubé, the Associate Medical Officer of the City of Toronto.
Hi, it's Dr. Dubé here. I'll go ahead. Just want to say I'm really pleased to be here from Toronto Public Health. Happy to talk about where we are at from a public health perspective with respect to COVID and vaccine certification, youth basketball and outbreaks as well too. So really happy to be part of the conversation.
Thank you. Thank you. And Tamara Brown?
Hi guys. Yes, like I was saying, I'm just so happy to be a part of this discussion. I'm happy to be a part of it in the way of a parent and a healthcare provider and someone that has been a part of Scarborough Health Network's vaccine clinic from December. So I'm just happy to be here to just kind of just give my input and some, and just kind of hear what the panel has to say. So thank you guys for having me.
Thank you for being here. And now we also have RJ Williams, President of Mega City Basketball Association. Welcome.
Thanks for having me, guys. We good here on the mic? Yeah, RJ Williams from Mega City Basketball. We hold men's and youth programs across the city of GTA. Thanks for having me again.
Yeah, pleasure. Thank you. And we have Ro Russell, founder of Grassroots Elite Canada.
Hi, how you doing? Glad to be here to support whatever we got going on with our Black community and to educate our community and our kids in terms of what they're doing. So glad to be here.
Thanks for being here. Thank you. Jamie Coote, Managing Partner, The Playground Global.
Hey guys, good evening. Again, my name is Jamie Coote, Managing Partner of The Playground Global. Manage a chain of basketball facilities around the city. And I'm really here to make sure that I get educated on ways to get back to youth basketball and conducting sports safely, because that is our biggest MO here. So I want to make sure we can conduct youth sports safely in our facilities and around the GTA.
Thank you. And we have Jeremy Kaye.
Hi guys, my name is Joey Kayeye. I'm the lead assistant coach for Ryerson Men's University. I'm happy to be here with a lot of people that I've looked up to throughout my whole life and looking to just listen, learn, and offer some value.
Perfect. Thank you. And we do have the Honorable Judy Escrow, Federal Member of Parliament for Humber River Black Creek. Is she with us?
Yes, I am.
Hey, welcome.
I am the Member of Parliament for Humber River Black Creek. I also, JCA is in my riding, and it's a place that I visit and have lots of events that I get to participate in. So I'm very happy. I want to thank you for the invitation tonight. As we continue to battle this terrible virus and having such qualified people on the panel so that we all can continue to learn about just how we can improve the quality of life for all of the members, not only of Humber River Black Creek, but for all Canadians.
Thank you for that, Judy. And we'd like to welcome back Dr. Tahira Redwood, internist public health, interventional cardiology fellow.
Hi, thanks for having me again. It was a great conversation the last time, and I'm looking forward to the questions from everyone. This time with hopes to, as usual, dispel myths, assist with misinformation, and just get our community vaccinated. And I also want to thank the JCA for having us here as usual in Black Creek.
Thank you. Thank you. Luwan Agba Selassie, Implementation Lead, Social Medicine and Population Health, University Health Network.
Good evening, everyone. It's a pleasure to be here. Pleasure to be back to continue the conversation. Thank you for having me. And as Dr. Lin mentioned, I am the implementation lead of the Social Medicine and Population Health Program at the University Health Network. With regards to vaccinations, have been working very closely with Black Creek Community Health Center to ensure community-led vaccination efforts in the region of Black Creek, Humber River. So really glad to be here today and part of the conversation.
Thank you. Drew Ebanks, founder CEO of On Point Basketball.
Yep, thank you, Doctor. It's good to be here. Good to be around all the people everybody here that I know. We need to have these discussions because we want to have great basketball events. We want to keep the kids safe, and that's what we're all about. Just to be able to live our lives again. You know, most people, have done kind of what the people say to do is to get vaccinated, but there's a lot of misinformation out there as well. We just want to provide that information so people can make the choice that they want to make as far as with the virus and also obviously with the vaccine. So I'm very honored to be here amongst everybody.
Thank you, Drew. Thank you very much. All right, Chris Skinner, co-founder of Triple Balance and Canada Elite.
How you guys doing? It's a pleasure being here tonight. Definitely want to get into some discussion how we could get basketball in a safe manner. Been involved with Triple Balance, Canada Elite from the start. Also a founder of United Scholasticus and having a new school. So a safe environment is very important for us. Mm-hmm.
Well, thank you very much for that, Chris. Devin Jones, educator and director of YACE.
Yeah, thank you so much for inviting myself, and I'm representing the YACE family. Looking forward to this conversation tonight about how we can have meaningful dialogue, based on science and based on dispelling a lot of the myth in our community around this virus, and as it relates to the sports and education piece of it, like how we can move on and put meaningful infrastructure in place that's safe and conducive to the health and well-being of our children and youth. So looking forward to this conversation. As I said, the piece around science and the piece around meaningful conversation and meaningful dialogue is important, and I hope that we can dispel a lot of the myth and move forward in a fundamentally scientific way.
Thank you. Okay, Claude from the OBA.
Yeah, my name is Claude Nemhard, representing Ontario Basketball Association. I'm not going to repeat what everyone's been saying, but I think we need to get some positive conversation as we had last time, but as much as getting conversation, we have to get something on print and in social media that people can see, so we can make some changes, keep people informed, and get this going again. I mean, it's been a lot of talk. Like, a lot of people know what needs to be done, and we need to get positive information. That's why the doctors are here, to reinforce what's going on. If you have questions, the answers are here. So let's move forward, because we need to get back to moving again for many, many reasons. Too many kids are not playing, mental health, so many things besides basketball, even though that's my passion, that's why I'm kind of here. But, you know, as a father, these kids got to get playing sports again, get back to their lives. So thank you.
Thank you. Clayton Thomas.
Thanks for having me, Black Creek. Thanks for having me, Doctor. Just looking to build on the great conversation we had 2 weeks ago in regards to COVID. I learned a lot of information, more than I've ever learned in my life. And just looking to continue to learn a lot more and go out there and educate the community and educate the students that I work with and educate my peers on the information that's being told, and eventually, you know, get vaccinated and keep our people safe.
Patrick Shaw, founder of My Brothers and Sisters Youth Organization.
Hello, everyone. Excited to be here. I learned more about the people around the table and their thoughts and their feelings and how they're striving or surviving in this new world that we're dealing with. So it's good to have this robust group around, because we are coming from different spaces. But at the end of the day, all our meeting points are basketball, getting the kids playing again, you know, being in a safe, conducive environment, but also finding about the other stuff, which is really important to me, which is the mental health aspects, the socioeconomic aspects. How does it affect us as business people, but also as parents, as educators, as, you know, community development people? So there's a whole bunch of pieces, and I don't think, you know, the wide masses understand how important all these little things go together to make our communities.
Well, thank you, Patrick. Okay, and Chris Campbell, founder of PTR, League Motion Belt Sports.
Thank you, Doctor. Once again, it's a pleasure being here. It's my second week here. Last week, I learned a lot of information that I didn't know about, and I was able to apply it. Having conversation with members in my community, my circle, about their thoughts and sharing and looking to build upon that. I think Patrick said it best. A lot of these things that we're talking about has different components to it that we got to look at. We have to analyze and come with, you know, certain results, or at least an action plan to get to a better place, not just for basketball, for all sports, to play, and we have on the same page so that all the kids are playing again. We're able to have spectators again, you know, back to kind of like that normal what was before this pandemic happened. So I love looking at people around here. It's a lot of people I respect, admire. I see their work, and I'm hoping that we can come to agreements and then figure out a nice action plan to get forward, to move forward.
Right.
Thank you.
Thank you so much, Chris. And of course, Dr. Upton Allen, a professor of pediatrics at the University of Toronto. Are you online with us?
I'm here. Thank you very much. I'm so honored to be with you, and thank you for organizing this, Black Creek, JCA, and of course the basketball leaders. I think you're doing an amazing job trying to get people together to have a conversation so that we can get the kids back to play safely. And so I look forward to interacting with you.
Thank you, Dr. Allen. And Ralph, producer for Life of the Dot.
Thank you. I'm here with some amazing men, Mr. Shaw, Mr. Jones, Mr. Nemhart, Mr. Russell, and the hesitation amongst Black men to get vaccinated is a discussion that we must have. There's literally a line drawn in the sand right now for those who are supporting it and those that are not supporting it. We have prominent community leaders saying don't do it. We have prominent community leaders saying to do it. doctors and scientists on a side saying don't do it, doctors and scientists on the other side saying to do it, and we have come to a legitimate crossroads, and we have to decide amongst ourselves as a community, what are we going to do? And I think this type of discussion holds true to that. And it's really important that we get the truth out. It's really important that we come together, and it's really important that we dismantle the fear and the name calling and this ideology that to get vaccinated is you're on the other team, and if you do, you're on this team. We're all here together, and we're all here to support each other. And I'm really happy to be here, and I want this to move forward.
So much, Ralph. Always keeping it real. Appreciate it, brother. All right, so let's jump right back into the discussion where we left off. So in the first locker room, we had lots of questions, great conversation about COVID vaccine side effects, risk, benefits, and potential impact on sport tournaments and the athletes. Where does that leave us tonight? I'd like to start by inviting a returning guest to share anything and any thoughts, any reflection they may have had after the last discussion. You know, did you learn anything new? Did anything surprise you? How were you feeling after the conversation? Did anything change or shift for you? So, Mike George here. Clayton, any thoughts? Anybody wants to pass on? Whoever wants to share their thoughts. It's a discussion tonight. This is an open mic.
My question, because I'm in a very prominent chat group, and we get discussions all types of time. 2 a.m, 5 a.m. It doesn't stop. Guys posting this at this doctor said, guys posting this at that doctor said. I think the biggest fear, and it is a fear, is why is the government pushing this on us? And it's a natural, shouldn't be, but it's a natural fear that a lot of us Black people have for the government. And it's now like the government in cahoots with the medical industry. And it's we don't know if it's propaganda. We don't know if it's all types of things happen. So I would like to know from the doctors, is it the government pressuring the doctors, or is it the doctors pressuring the government into what should be happening right now? Because we don't know. And we see doctors, Black doctors, prominent doctors, saying that don't get it. We see Black doctors and prominent doctors saying, do get it. Who do we believe?
Always insightful. Thank you, Ralph. Yes.
What the doctors have to say.
Yeah, so maybe we can have Dr. Dubé answer that question. Thank you so much for that question.
Yeah, thank you for
Yes,
that question. I'm from Toronto Public Health, so I work for the government, for the municipal government. But I want to say that the government actually hasn't forced anyone to be vaccinated. And I think what we're seeing now is there's choices that if you're vaccinated, you can do certain things. And if you're not vaccinated, you can't. And that's really just to prevent the spread of COVID. It's really not to stigmatize people. And I really do understand the discord and when it's conflicting information, how problematic that is. But I want to reflect on the vaccine certificates that were announced. And in a community center, a gym, if for participants who are playing, who are 12 to 17 years of age, vaccination is not required. The government did not go that far to require it for that age group. But what they are asking is that organizations, really the sports organizations, make decisions for their communities. So we've seen, for example, Ontario Hockey, minor hockey, the Greater Toronto Hockey League, they have come out with their policies requiring vaccines for their participants. But the government hasn't actually made that decision. And so I just want to leave that with you, that really now the ball is truly in your court to be able to make that choice to protect your players, because it is such a high risk activity in the gym, indoors, not wearing masks, can't keep a distance. So I just thought I'd start there. Thank you.
Thank you, Dr. Dubé. That is good food for thought. Dr. Allen, you want to touch on this, please, as well?
No, I think it's a very important comment that was made with respect to who to trust. I realize how confusing it can be, and maybe it's an opportunity for us on the medical side, public health, Black Creek, and others, to help you to identify the appropriate sources of information that we would see as being credible, because I realize how absolutely confusing it can be where you go into social media and somebody's doing a 5-minute video and it has the name doctor in front of it of their names, and you assume that, wow, that must be credible. So we have some work to do to help to make sure that you get the information that you need from credible sources. The other point that I just want to mention, because this has come up on several occasions, and that is are Black folks disproportionately affected by COVID? And the answer is overwhelmingly yes. That is the case in the United Kingdom. Black folks were more than twice likely to die from COVID. It's the same in the United States, and we're seeing disproportionate representation in Canada as well. So we have very good reason. The system, public health, has very good reason to protect Black people because of the disproportionate representation of COVID cases, including death among the communities. Now, we can get into the reasons for that later, but I just wanted to add that.
Perfect. Yes, Judy, go ahead, please.
Thank you, Dr. Allen.
Yes, thank you for the opportunity. Let me say there is absolutely no conspiracy. Vaccine medicine and immunologies are one of the most studied and understood areas of science. And this is an issue of public health. And it is an urgent issue because there continues to be deaths that are unnecessary. But the high immunization rates that we're seeing are a testament to the safety of all of these vaccines. So it's imperative that we continue to work together to protect each other and assure you that the government only reacts when we have solid science advice and direction from public health and the various provinces, and here in the province of Ontario. The government is not out to create difficulties for Canadians at all. Thank you.
Well, thank you, Judy. Luam, did you want to comment?
Yeah, just to add to the great conversation, I think we've started off at a point where we were kind of leaving off at the last time we were here together. So I think it's a fantastic place to start our discussion this evening. And, I hear you. I mean, I have the same conversations with people in my family, with friends, there's definitely questions that I've heard, and, we've all been talking through. So I think one thing to add to the comments that have already been shared is the data just is so clear. So the question you asked was, is it coming from government? Is it coming from science? And I think it's policy informed by science. And even when we're thinking about vaccination efforts, that work we've been doing with Black Creek Community Health Center, it's being driven by data. So looking at where COVID has had the highest impact, looking at how we can respond to provide protections, in this case vaccines, to communities that have been impacted the most. So I think that also seeing how widespread COVID is, and how effective vaccines have been at preventing illness and preventing death and hospitalization. So the data is just, because it's so clear, because so many people have gotten so sick so quickly, and because vaccines have been spreading so fast, it really informs policy, and I think has given a lot of confidence to say, we can make these policy decisions to ensure that there's the highest level of uptake of vaccines possible to protect the broader community. But just to say, I understand how it can be perceived as, and to add to what's already been said around what's already floating on social media and misinformation around this is government and scientists in cahoot, or but just to say that the data has been so clear in showing that vaccines have been so effective at protecting people from hospitalization and from serious illness, and reducing the burden of illness across the gamut, that it really just informs the policy to say this is the right step to take to make sure as many people get vaccinated as possible.
Thank you so much for that, Luam. I appreciate that. So, yeah, sure. Go ahead, Drew. Thank you. It's a conversation. Go ahead.
Great
brother.
points by everybody. I've been in the media quite a long time, and I think part of the reason, and we are in the same chat group, Nkrumah said, and it's the I think the messaging could have been better, and I think it can still be better. When we were here the last time, we heard about viral load, and the doctors talked about that. You bring up viral load, and then people say, well, has that been tested? Has that been proven to say that vaccinated people and unvaccinated release the same amount of viral load? I believe you guys said the last time that was not the case. So people even still doubt that. Also as well, how long the vaccine took to come to market, essentially. People think still that it was a 9-month process, when you guys explained the last time as well how long they've been working on coronavirus and, you know, SARS-CoV-2, which is what this is and whatnot. I think, again, people don't have the government or don't have like the doctors coming out and saying these points that need to be clear to so people can understand it's not a new thing they just developed. You know, there is a difference between how a person who's vaccinated sheds the virus and how a person who's non-vaccinated sheds the virus, right? Because most people are saying, well, if you're vaccinated, you're still spreading it, so why should I take the vaccine? What difference does it make? And also, we can get into the health part, which I'll probably talk about a little bit later, about being healthy and eating right, and people think that's the way that's going to prevent them from ever getting it. So I think the messaging has to be a lot better from the leadership to, you know, map out and just let people know these are the facts of when this thing was started to be worked on, what viral load is, what the difference is between a person who's vaccinated and not as far as spreading the virus, and why we should have as many people as possible get this, especially in the Black and brown BIPOC communities, because there is doubt from historical incidents where, you know, we were experimented on, you know, and so that has to be, I think the people out there have to say there's a double thing that has to be done, especially with Black and brown people, because, and they're not acknowledging that. I think they're just saying everybody in a brush, hey, you guys all got to get vaccinated, but there is hesitancy, and it is a rightful hesitancy. They do have a right to be hesitant.
Yeah, absolutely. I can understand where you're coming from. Patrick, go ahead.
To jockey on what everybody's been saying, I think one of the big issues from what I'm seeing is the messaging comes out as a reactionary. And some of the things that I think could be done is with information, what, you know, people are saying, you have a cheat sheet. And you have those information in front of every group in these high needs, high COVID communities, because the distrust is there. But it's also, like Nkrumah said, is the information from the people against the vaccine is more concise and very pinpointed to their point. Where on the opposite side, it's almost like, I did it in my generation, this is how you do it, you shouldn't question it. So I think we have to be cognizant and be real to see that you have to now change the approach for the demographic who is a little bit more hardened, a little bit more staunch in their thing, and then they're getting inundated with, you know, Dr. So-and-so, Dr. So-and-so, Dr. So-and-so, who looks like them. And then the messages on the other side is you're getting information from Dr. So-and-so who doesn't look like them. So you have to look at even that point and saying where the information's coming from.
For that, Patrick. So I think Dr. Dubé wants to comment as well too. Go ahead, Dr. Dubé.
Yeah, these are fantastic points, and I just want to talk about the piece on viral loads and, you know, the messaging on that. And I think if you've gone to either the Toronto Public Health website or the Ministry of Health website, there's now data on who's getting COVID based on vaccination status. And so you can talk about it in terms of odds, like forget about viral loads. You can say that if you are not vaccinated, you're 7 times more likely to get COVID. If you get COVID and you're not vaccinated, you're more than 20 times likely to end up in hospital. And if you are unvaccinated and get COVID, you're more than 40 times likely to end up in the ICU. So that's just another way to talk about it based on real data, based on the people who are sick right now. In fact, I'm looking at the Ontario.ca website. In the ICU right now in Ontario with COVID, 115 people are unvaccinated compared to 10 people who have had 1 dose, compared to 13 people who are fully vaccinated. So that's another way to help reframe that question. I think the other piece to mention about the statistics is sometimes it's better to share your story. And I think that's what I would really urge all of you. I can tell you my story. I've had my colleagues, I'm a physician, I work in an emergency department. I've had my other physician colleague, otherwise healthy parent, die, at 60 something from COVID. And that honestly was so tragic for me. And I don't want that to happen. So sharing those stories can sometimes be more effective even than countering some of the anti-vax rhetoric with facts. So just commenting on that too. Thank you. Thank you.
Thank you, Dr. Dubé. Dr. Allen, you wanted to comment as well?
Yeah, no, I think I agree 100% with Dr. Bay. I was going to make 2 points. I do agree with the points that Nkrumah made, and I think it's really important to hear some of these things and to be able to have the questions that you have asked answered. The question of viral load, if I remember the last time, came up in the context of if people who get vaccinated can still get infected, why get vaccinated? And so there are different messages that are associated with the question of the vaccinated person versus the unvaccinated person. But the bottom line, as Dr. Dubé has clearly indicated, is that there is overwhelming evidence that strongly supports that if you get vaccinated, your chances of having a bad outcome are significantly diminished. And she's given you the numbers. But in addition to that, the person who is unvaccinated in the setting of a gym is much more likely to be transmitting virus than somebody who has been vaccinated.
Thank you very much, Dr. Allen. All right, I'm going to ask Judy Escrow to comment. And Judy, from your standpoint, after hearing some of the conversations tonight, what do you think you can do to help support these communities better?
Thank you very much. My apologies that the video just isn't able to work. But can I begin by saying how important many of the players that you have are in the community with getting that message out about the safety of this vaccine. It has been tested. It has been well over 8 years, ever since SARS has been done. So it is safe. But I think part of our problem as a government is what else do we do? Spend a lot of money trying to convince people, but people have real fears. I spoke with a woman today who got fired as her office manager because she refused to get the vaccine. So the issues you're talking about are really important. And if I would really appreciate getting our advice to the government, to us, to know what else we can possibly be doing to ensure the safety of our constituents, of our residents. When you ask about what different things that we have been doing, I see you have Yates there with Devon Jones. the government of Canada has put into well over 60 organizations in excess of $100 million to support Black Canadians communities initiatives, a variety of initiatives that, and part of my job is to make sure that people know that that kind of funding is out there. I think funding has finally come to the table in excess of hundreds of millions of dollars. And it's important for everybody to know that that money is out there in a variety of different funds. Then it's there to make a difference in the lives of many in the Black community. And that I would like to see us all talk about some of the benefits that would be there as a result of accessing some of these fundings. Certainly, I know with YACE and many of the other organizations in our riding themselves, I have a whole list of them that all receive funding under the Supporting Black Canadian Communities Initiative as just one of them, but there have been many, and they're meant to lift up the community, let the community know that we are there. So thank you for the opportunity to be here this evening, and I continue to listen and learn as well.
Thank you, Judy, for that. Thank you for joining us tonight as well, too. Patrick. Just give me 1 second, Ralph. Patrick, do you want to say something first?
Well, thank you, Judy, for your comments. One of the things, and I think I'm speaking for everybody around the table, even though there are monies out there for the Black community, we know that it's never enough because it's paying off for what happened in the past. One of the biggest things that I see in terms of being in the community hardcore for about 25 years is we're always, once again, reactionary. So my question is, coming out of COVID, possibly going into the fourth wave, and our kids saying, listen, you're not going to keep me in the house anymore. I want to play sports. I want to do things. I want to get my life back. The youth that had potentials to go into school, scholarships, had opportunity that was right in front of them, and COVID took it away and possibly can take it away for a third year. Business owners who've just opened businesses, and some of these funding is you have to be in business for a bunch of years. What about I just got into business, spent my whole life savings, created a plan, and I'm out it. So like we said in the messaging prior on the anti-vaxxers, it's also a messaging that needs to come out to state that we need to support now, but it needs to be not reactionary. So how, and the last part of that caveat is, how do we access that money? Because people who do not look like us around this table or around this group are telling us who gets that money. I've always been a big proponent of people like this around the table who know the works, have done the work on the ground, should be the ones making the decisions. We have never had that opportunity on a large scale, and you can't say we can't do it if we've never had the opportunity. So that would be my caveat to saying there's money out there, but then tell us how we access the money on our terms versus somebody else's terms.
Thank you for that, Patrick. Judy, go ahead. You can respond. Thank you.
And I agree with you 100%. And it's been an issue for a long time. And I have to say that now the Black-led Philanthropic Endowment Fund, which is going to be $200 million, and the $100 million for supporting Black communities, those are being administered, and those decisions on most all of these programs that we're talking about came out of the Foundation for Black Communities with $200 million from Ottawa to start trying to find how do they reach out and make sure that people who own businesses can find ways to overcome the barriers. They're unrepresented entrepreneurs, and we need to be opening the door. And the fact that $200 million was on the table in the 2020 budget for Black Entrepreneurship Loan Fund. But more than that, it's how do we make sure that these funds are available, and that this philanthropic endowment fund, as well as the other funds that are being administered, they're finally being administered because your message got across. I don't know before, but it got across to this government. And so these funds are being administered by other businesses, other folks in the Black community. And part of my job is to make sure you know that those funds are out there and they are available for you. And I'm prepared to give you all of the help, as many of my colleagues would do, I am sure.
Thank you so much, Judy. Thank you for that. All right. Is there any other comments that anybody wants to jump in? Ralph? All right, Ralph.
And it just goes back into my question. It's majority of us Black Canadians are Caribbean descent direct or African descent direct. We've been taught if you eat healthy, you exercise, you keep a strong mind and a strong heart, you can fight anything. You can basically fight anything off.
Yes.
Right. The only thing I've seen really rip through our community is cancer and diabetes. Right. I think the hesitation amongst us as Black men as far as COVID is that if I'm a healthy man and I don't get sick, I exercise, I eat whatever natural foods I was told to eat.
Yes.
Why is it that I'm not given the opportunity to fight it?
Great question. Thank you for that, Ralph. Anybody want to comment and respond to Ralph? Or Oh, the audience can hear. Okay, then we can have Ralph repeat that again. Yeah, just do a short version of it. Do the short version, Ralph. Yeah, go ahead.
Just to put in brief, again, as majority of us Black men are Caribbean and African descent, we've been taught at a young age, eat healthy, exercise, you should be fine. I think a lot of us feel like that choice is being taken away from us. We should be given the opportunity that if we can basically, quote unquote, police ourselves and police our health, why is that opportunity being taken away from us? I think that is how a lot of us feel. And why is it being forced upon us? And that just jumps on to what Patrick is saying in regards to okay, now you say you're gonna help us with funding, but then again, no one who looks like us is responsible for that funding to give us. Or you might pick one person who's responsible to represent all these 100 Black businesses. It's ridiculous, right? So again, it's that lack of trust that we have.
All right, thank you for that, Ralph. You want to comment on that?
I can kind of answer that because I feel the exact same way as you do. And I know I have a lot of student athletes that feel that same way as well too. And I'm just going to touch upon the point of the right of us fighting it because I'm from Congo, so I got that conversation from my parents with the supplements and all the good stuff. But it goes towards what I got from the panel, the last panel that was here, and just the different conversations that I've had. It goes towards it's bigger than us and it's bigger than you. Because while you might be able to fight it, someone else might not be able to. So that's kind of the thinking that kind of turned it around for me to be able to know, okay, this is not just about me, because I know I can fight it. I feel like I can, right? But if I know the person beside me can't, not everybody's built like us. Not everybody's built like me, right? So it goes towards kind of going away from just me and seeing what is good for the whole. So that's where I'm at with that.
Jeremy? Dr. Redwood?
So just to also answer your question, I did most of my medicine in Jamaica, right? So I'm around Rastafarians. I have Rastafarian family. Ital is vital, healthy, everything, right? Raw food, everything. They're still getting sick and dying, right? COVID does not discriminate that you're healthy, so you're gonna definitely live, and you're not healthy, so you'll definitely die. You have 105-year-olds that get COVID and survive, and you have 30-year-old healthy people that get COVID and die. Like I've seen it myself. I had a 30-year-old female who was deathly sick, and if she didn't have a machine and was going to get lung transplant, there would have been no hope for her. It doesn't, yes, you may have a better chance for sure. Like the stats show, like if you have chronic illnesses, you're more likely to get very sick. You're more likely to die. But also if you're healthy, you still have that chance of dying. And that's what we want to avoid, right? Of course, I'm all about keeping healthy, but 1 out of every 10 people that are healthy, that have heart attacks, are super healthy. They go to the gym, they're marathon runners, they eat healthy. And even with like student athletes, like they're super healthy, but there's ailments that affect them, right? Their sudden cardiac death is like the leading cause of death in athletes. You just can't predict what will happen to you. If we could, then of course we could say this group doesn't need to get vaccinated, right? If it was all about ITIL being healthy, then if we're saying that our community is healthier than other communities, we shouldn't be dying at a faster rate than other communities, right? So our thing is looking at the data, as Luam said. We use the data. My thing is data. Like, I read the research, I read the numbers, because I want to be able to give the most accurate information, especially when I come to forums like this. And my thing is, the data shows that we're dying regardless of what we eat, right? It shows that young people are dying. All of the children's hospitals in America signed a form saying that they recommend vaccinations because they're seeing that the kids are dying too, right? Healthy kids. And we don't want that, right? So being healthy gives you a better chance of fighting it, but I can definitely say it does not rule out that, something bad cannot happen to you.
Mm-hmm. Thank you so much, Dr. Raywood. And I just want to comment again. I don't think just to kind of get it clear. I mean, I think we want to still encourage a healthy lifestyle. We always talk about that, like diet, exercise, all those things that I don't think those rights are being taken away as far as I know. And so I want to make sure that messaging is, please, our people, we have to continue to eat well, to exercise, and to monitor our health. Absolutely. Go right ahead.
And I think Dr. Allen mentioned credible sources, and I'm glad that I'm sitting here with individuals who are credible sources. You mentioned children are dying. What's the legal age to make a decision? Is it 18? When you're 18 or 16, you can make your own decision?
It depends, like decisions for what specifically?
The decision to be vaccinated. So my question is...
Yes, Clayton, go ahead.
Sorry, go ahead.
So, I mean, I can defer to Dr. Dubé, but at this point, you don't need parental consent to be getting a vaccine as a 12-year-old and above.
Really? Yeah. So that was my question. So 12-year-olds are allowed to make a decision on their own on getting the vaccination. That's correct. Right. But the legal age to become an adult is 18? Okay. So I guess you answered this question that a lot of children are dying. Is that why they changed the policy to allow 12-year-olds to make their own decision to become vaccinated?
Thank you for that, Clayton. Luam, you want to comment?
I'm wondering if Dr. Dubé would want to take this question.
Yes, Dr. Dubé is online. Please, Dr. Dubé, go ahead.
In Ontario, we have what's called the Healthcare Consent Act, which has been around well before COVID was around. And it has no particular age to be able to make a decision for healthcare. But the person who's making the decision has to be able to understand why they're making the decision, what the treatment is for, what happens if you don't take the treatment. And they have to be able to understand that. It's up to the healthcare provider to be able to assess that. And if they can, then that person can provide informed consent. It is not just related to vaccines. It's related to all kinds of other health interventions that teenagers go through without requiring parental consent. That is just the law in Ontario that predates COVID.
Thank you, Dr. Dubé. Tamara, you want to make a comment on this?
Yeah,
as well?
I can second that. My background is pediatrics at North York Gen, and we have kids making decisions if they do understand before COVID, right? Making decisions on their healthcare if they understand the complexities of the procedure that they may be going through. So it's not just COVID where they're like, oh, let's drop the age of consent so we can give these kids the vaccine. No, this has been around for a while. So I just wanted to make that, like, just jump onto that point as well. Okay.
And I know there's a question as well too. Go ahead, Drew. Go right ahead.
Yeah, I know last time the doctors, they did a phenomenal job just explaining the whole process around vaccination and how the vaccine works. I mean, I was talking with my son, and again, like, the young people, they have so much misnomers around this process and around just the science behind it. So I know he's watching tonight, and I'm hoping that we can again talk about the vaccine and how the vaccine works. Like, there's misnomers around that you're injected with the virus. That was dispelled last week, and thank you very much. But like, just how does the virus works? How does it protect us from contracting the disease? Like, how does the vaccine work?
Thank you for that, Drew. Who wants to comment on that? Any of the physicians? Dr. Redwood, you want to touch on that? Thank you.
Okay, so as we mentioned last time, how the vaccines work. So there are two types of vaccines. One is the mRNA, which is made by Pfizer and Moderna, and most of us have taken that one, or that's the recommended one. The Pfizer is recommended in persons under the age of 18, and then the other type is AstraZeneca, which is a spike protein. So in terms of the mRNA, so you get the injection, right? What the mRNA vaccine is, it's like an instruction list, and I think I explained this last time. It just basically tells the body what proteins it needs to put together to make what is necessary to fight the virus, basically. So it doesn't go anywhere near DNA. It actually goes in a completely different part of the cell than where DNA is stored. So it doesn't interact with DNA. There are no, you need specific enzymes from your body to even make DNA. And those enzymes do not interact with mRNA. So the mRNA is not a virus. It is just a short strip of, to break it down, like nucleic acids, which is just like a list of things. And it just binds with other nucleic acids, which builds what we call a spike protein. And the spike protein helps the body make cells to fight the virus. So no interaction with DNA, no virus, nothing like that. I don't know if that was clear. Spike protein, and that's AstraZeneca, which we don't really use as much in Ontario. The spike protein is basically the end point of what the mRNA vaccine does anyway. So the mRNA vaccine, when it gives that list and it puts together the nucleic acids to make the spike protein, AstraZeneca is basically just giving the spike protein. It just skips that mRNA step. So it doesn't do it from the beginning. It just skips the steps.
Thank you for that, Dr. Wood. We have Mr. Dwight Drummond here, my cohort. Thank you, sir. How are you doing today?
I'm good. I guess I'm just here to provide any answers people have about the media in this. I was the moderator last time. Now I want to be part of the panel, man. So I think that, the media is playing a role in this with because we're kind of fighting misinformation ourselves. And Kruma was talking about all the information he's getting. And we're trying to fight that in the mainstream media because a lot of the info that's being sent to people, and I get it on WhatsApp because I have a lot of friends and they send it to me. These are just people making up videos in their basement saying nothing. And I'm asking my friends to at least Google the name of that person, Google the name of that news site. Try to find out because it is not a legitimate source of information. We can't get medical information from Nicki Minaj. It's so important.
Very insightful as always, Mr. Drummond. Thank you.
So I just want to comment on that. I think you brought up an important part, right? So everyone knows what Nicki Minaj says, but no one knows what Dr. Tam said, right? It's because that's what influencers are. Influencers are non-medical people, but everybody watches Jay-Z, they watch Drake. So whatever they post is gonna go viral and you're gonna be like, oh, but they're saying this, right? But those aren't credible sources, right? You can't say my cousin's friend, bro, it's not even your friend. You don't even know this person. It's like that alone X's it out, right? Fine, somebody might have that experience, but that's not a credible source. But unfortunately, that person has millions of followers. That person has way more followers than Justin Trudeau. So what Justin Trudeau says does not reach or infiltrate to our under 18, under 21, under 12-year-olds because no one's watching Justin Trudeau, right? So that's unfortunate. And yeah, you can Google the name and there are doctors that say stuff, right? And that's the nature of science as well. You might have 80 doctors agreeing on one thing and 20 doctors not agreeing on one thing. Different people will manage your diabetes some way, different will manage it another way. Science is about disagreeing, agreeing, using the data to try and make the best decisions for the general public. And there's always going to be someone who disagrees with what one scientist says. There are people that said Albert Einstein was an idiot. He's one of the greatest scientists. There's always going to be people, top people that are going to be saying disregarding the truth, but that's their beliefs, right? They use their data, their interpretation of what they think or what they believe the research says, and which may or may not be accurate. But when you have a consensus, meaning majority of the doctors, majority of the policymakers agree on something, you have almost the entire world agreeing on vaccine. Like, when have you ever seen the entire world agree on doing one thing, right? And you have the entire world agreeing that they need vaccines, they need to get rid of this pandemic. And that, to me, shows how important and how strong the data is, as Luam had mentioned before.
Dr. Redwood, I think we have Dr. Allen who wants to comment as well too, and then we'll have Dr. Dubé after Dr. Allen. Go ahead, please.
Thank you. There are kind of two comments. Just permit me. I think earlier, I think it was Ralph had mentioned about if you eat well and you're healthy and exercise. And I just wanted to comment on that because it is so important for you to do all of these things. But it just so happens that this particular virus, along with many other viruses, even when you're healthy and well, and you're looking like Dwayne Johnson, the way that the virus interacts with your immune system, it can still kill you. And even when you're well, it might mean that you might still be severely ill, and being well and healthy otherwise might mean that you spend a week in ICU instead of 2 weeks in ICU, but you're still really quite ill. And I think you just have to look at what Dwayne Johnson said. He really got really badly ill, severely ill with COVID. But not only that, he said that his family members, his young daughters got ill as well. And so to speak to the point that I don't remember your name, the person from Cameroon, is that you're not only protecting yourself, but you're protecting your loved ones around you. And so that is really, really, really so important. The other thing, if I might just briefly mention, Martin, while I have the phone,
Yes.
is an example that I often use to explain, how the vaccines work, is to think that, imagine there's an echo there.
Yeah, just one moment here. IT?
Okay, all right, yeah. So the
Dr.
way,
Allen? Dr. Ryan
yes,
now.
the way to think about it is imagine that you see a car driving on the road, and your eyes are trained to recognize this is a Mercedes because it has a Mercedes emblem, and you react to that. Well, your immune system is like that. If you present the whole entire virus to the immune system will react and make a little policeman that will attack the invading virus. But you can also essentially give the immune system just the Mercedes emblem, and the immune system recognize, wow, that's a Mercedes. This is a virus. This belongs to the COVID virus. And that's where the spike protein comes in. And the immune system then develops these policemen targeting the spike protein. And then you can have different ways that you can get the body to have the spike protein. You can give the body a message to make the spike protein. And that's where the mRNA comes in. And it just is a message that makes a spike protein. It's like the message that makes a Mercedes emblem, and you recognize that is a Mercedes. So that's kind of how the immune system works to respond to these vaccines. So that's one way that I use to explain to people so that they can go home and explain to their loved ones as to how these vaccines work.
Thank you so much for that, Dr. Allen. Dr. Dubé, are you going to chime in on this one?
You know what? I'll just say one thing, and that,
Tamara. Okay, Tamara, go right ahead, please.
Go ahead, Tamara.
No, go ahead, Dr. Dubé. I'll go after you. You started.
No, I just want to say that in questioning the science about vaccines, it's the same science that we use when you come to see me in the emergency department because you've had a cut or a fall or someone's had a heart attack, or when you get COVID, someone gets COVID and they come to the hospital to get treatment. It's the same science. That's the same science. So if you can trust the science to treat you when you're sick, to go to the hospital and to be hospitalized, to be attached to the ventilator, it's that same science that you can also trust for the vaccine as well too. Tamara, over to you.
Thank you. I was actually going to say the same thing. When my mom decided, well, she decided to get the vaccine. She was very hesitant at first. Like, honestly, I didn't encourage anyone really in my circle. I just provided them with the facts and the information. That's what I did for myself as well. I was nervous when I got it, my second dose, January 17th, 2021. I'm still nervous to this day, but I did my own research. And I think you have to do your own research in order to make that decision for yourself. You have to, I don't think the PR of COVID and what the vaccine has done is enough in the media. We are now going into nursing homes, LTCs doing third doses. And we just went into a HOMA maybe a week ago. And a couple months ago, when we were in our first wave, they've had like 20, 30 people die. Now, since then, having gotten their second doses or going in for their third dose, they haven't had anyone pass away from COVID. That's not being announced enough. And I think that's super frustrating. You're not hearing the things that the vaccine is doing for these people. Like, I got my vaccine not for myself and not for anyone. I didn't get it for me. I got it for my family, for the people I work with, and for my community. Honest to God, like, I didn't get it. Oh, I don't want to get COVID. No, I didn't want to bring it home to my kids. I didn't want to bring it, to work. I didn't want to do that. So I just think the PR of it all is not great. I think they need to show people in the ICU beds. I think they need to show just more of those things so people are able to really understand and see the impact of it, because it's getting the fake media information and not really getting the truth. And I think that needs to be more out there than anything else. And that's my opinion on that.
Thank you so much, Tamir, for sharing it with us. I know there's a few people that want to jump in. Mr. Drummond.
Because she's mentioned the media and she's right, and it's really important. And it was on the competition, but the lead story on the competition last night, they were in Hamilton Hospital in the ICU with the doctors just saying, listen, we can't keep up with this. We need people to get vaccinated. You're coming in here younger and sicker and you're dying. And you're asking me for the vaccine as you're on your deathbed, and I can't give it to you now, right? And that was what was happening in Hamilton. The big story of my show today was what is happening in Alberta. Because Jason Kenney actually apologized today, and you never see politicians do that, saying, listen, we should not have opened, we weren't ready. They think that in 2 weeks they'll have no room in their ICUs. Their hospitals are full. And what is the one thing about Alberta that we all know? It is the lowest vax rate in the country. So it's not a coincidence that they're being bombarded now and they can't handle what's happening. But it all comes down to, if you look anywhere around the world, and she said, look at the evidence, and you want to put, everywhere you look on the planet, the higher the vax rate, the lower the death rate. It's just a fact. No matter what you want to say, and a lot of us are from Caribbean countries, and we can look to our countries of origin and see what's going on there right now, and they're dying. Like, Jamaica's in major trouble. My wife is from Grenada. They're saying, the Grenadian health minister said today, he thinks half the population will be infected with COVID in a couple of weeks because they had carnival, everybody went jab, and nobody's taking the vaccine or anything. So they don't know what they're gonna do. And a lot of these countries depend on tourism. And America said today, put Little Grenada, 90,000 on their list. They don't go to that country. So this is bigger than just us, but the same things that we're talking about in our community here is being reflected in the communities we originated from. And it's the same type of thing. And we're dealing with it in our community, and I'm not sure we have to. But yes, the media can do a better job of getting those stories out and educating people and saying, the numbers are the numbers. Men lie, women lie, numbers don't. And anywhere you look, the higher the vaccination rate, the lower the death rate. We're averaging about 18 to 20 people dying in Canada, I think a week for COVID. Jamaica had like 30. Grenada had like 30. We have 34 million people in this country. Grenada has 90,000, Jamaica has 4 million. We should not have the same death rate as those countries. And in the end, it comes to vaccination, because that's the determining factor for all of it.
Thank you so much for that, Dwight. I appreciate that very much. Drew, yes?
That was fantastic. My fellow media member Dwight there. A lot of the questions, and we've been in the groups the last couple weeks, and the thing I've seen from day one is, again, the messaging. Doctor, you said it, the messaging, and Patrick, you said it, I think. The messaging on the anti-vax side is like all over the place. My question is, a lot of people quote the survival rate or the death rate is only 1%. Why am I going to take the vaccine if only 1%? But I always say too, from what I understand about science and math and all that, I count numbers all day. Shouldn't you be looking at the number of people who get COVID and the number of people who died from COVID, and then use that as the ratio instead of, okay, this many people died based on the whole population of the country? I think that is misleading people to think that the odds are better than they are. You have to look at who has gotten COVID and who has died of COVID. As far as I understand, is getting the numbers right to say, hey, it's a pretty big risk. I mean, you might think it's 1%, 2%, 3%, whatever it is, but if you get this, you're taking a risk. And I wasn't sold necessarily on the vaccine right at the beginning. I waited and waited and waited, but again, I'm in the field. I'm always out with people, so I figured, for my safety and as Tamara said, for the safety of people around me, that's why I did it. But again, that number, maybe you guys can answer here. How do we combat people when they're saying there's only 1% that's going to die of a 99.9% of survival anyways?
Great question. Thank you so much for that, Drew. And thanks for sharing that. Dr. Allen, I'm going to ask you to please comment and respond to Drew, please.
Yeah, I think that, speaking more generally, there's an opportunity, and I feel really bad about this because I hear you guys asking questions that we have, meaning members of the medical community, have been answering for many months now. And it really speaks to the fact that, agree with Nkrumah, that we just haven't had a chance to get these answers out to you. And one of the things that I was going to suggest that we do tonight is to identify, one or two of you guys who could literally make a list of some of the questions that we're seeing come up. And I promise that I will work with you along with some of my colleagues and others and pull in, people like Dr. Dubé from Public Health to provide answers for you so that you can share those answers among yourselves. Because I'm hearing questions that are so important, but which were addressed before, and it just means that somehow you were left out, and I think we need to really try to fix that. These forums are really so important. I can share with you an opportunity that I had with Patrick. I don't know if Patrick remember this. Last year, we were meeting a bunch of young men. And we were talking about the flu vaccine, and this when we asked this person why they didn't take the flu vaccine, his answer was that he doesn't understand why he should be injected with a live virus to prevent the flu. And when we said, well, gee, the flu vaccine is actually not a live virus; it's a killed vaccine. It was the first time that he had heard that. And so it speaks to the need for us to have these types of sessions. And as I said, I promise you, I will help to answer your questions. If you come up with a list, we will work at them with you.
Thank you for that, Dr. Allen. We're going to hold you to that, and thank you again for being here with us to answer some of these questions here at the town hall.
Dr. Lin, can I just answer the number question?
Please, go ahead.
For
Go
Drew?
ahead.
So what they try to, because, there are provinces in this country with more population than most countries on the planet. So when they're giving numbers, they want to be able to compare apples to apples. So they usually do it, say, per 100,000. So if we're doing a homicide rate or anything, if you do it per 100,000, but then you can compare it to another country to say, okay, for every 100,000 people, this many people are dying. For every 100, so it just gives us something that you can compare ratios. Because, trying to compare Canada to Jamaica, because we have 10 times the population. But if we do it per 100,000, break it down that unit, then it's easier comparison to understand.
Luan, you wanted to comment on anything? Dr. Redwood.
Yeah, I think you answered that question greatly, but I also wanted to mention that you guys are leaders in your community, but you must also realize the extent that you are leaders. You're not just leaders in this community or maybe Toronto or Ontario. You're leaders in the Caribbean diaspora. There are people back home that will ask their relatives up here, what do you think about the vaccine? Jamaica, Grenada, there's no Caribbean country. Barbados is the first world country, and it still does not have the resources that Canada has, so that when their people get sick, regardless of if they were up here, they may have survived, they are less likely to survive in those countries. And they're watching us up here to see what we do. What are we saying? What is our community saying? So the impact is not only on our community, you guys are leaders across the entire Caribbean diaspora. And they're looking to you to guide them because you live up here. It's like your family. Like, you live up here, what you say goes, right? You are the breadwinners. They'll boast about you. You do this, you do that, and you're the leaders. So this is why this is so important, that you understand why it's so important for this, so you can let them know, because our families back home are dying, right? There are people dying every single day. It's ridiculous. It's like really bad in the Caribbean.
Very well, thank you guys. I want to jump into some of the, because right now we have basketball here, and we're not, I want to hear more from each organization. Like, what are some of the challenges you're facing? What are your concerns? And where do you think things are going to be going, especially with the young kids? Claude, do you want to start? Who wants to start on that? Go ahead, Russell. Who? Russell has a mic, go ahead.
So, as I'm thinking about this, when I look at my demographic, what I have a lot of young people who are not gonna get the vaccine or are still on the fence of getting the vaccine, have individuals gonna get the vaccine, and then I'm having an upcoming season of not sure if they'll be playing basketball or not, or where they're gonna be playing basketball, or if they are gonna play basketball, what organization is gonna allow them to play if they don't have vaccines. And then if they don't play vaccines, what's the mental health and the impact they're gonna have on that? And those are a lot of things that are building up that I have to sit there as a leader and consider. I have this young person whose parent doesn't want them to get the vaccine, but they want to play sports. They've been not playing proper sports or organized sports for the last year and a half. They're not even gonna get it probably in school this year. So they're not active. They're not doing those things. And then I have them with another group of kids who are kind of, some are vaxxed, some are not vaxxed, and they're okay with the kid playing, but he could probably do something, like he'd probably spread it or something. And if I tell him he can't be there, or he or she can't be there, then that's adding on and compounding the stress and the the mental health that they have to go through, saying, you know what, now I can't play this sport, I'm gonna just do it. Like, there's a lot of other things elements we gotta think about when thinking about our young people and how we're doing this. Like, when I look at, we have 12 to 17-year-olds who can make their own decision, who if they want to get vaccinated or not. But what's the point of saying 12, 17 can make their own decision if I can't put them in an organization to play anyways? So that's and I got to make that decision, try to figure, well, guess what? You can't play. And those are things that us community leaders and us people who run these organizations have to think about now, especially for our high-level athletes. So.
I love that, Russell. Does anyone want to comment on that? Patrick? Oh, yes. Yes, Claude.
When I saw what the government put out, I actually reached out to Patrick too, because I didn't understand. So I reached out to Claude and Patrick because I didn't understand when the government put out the mandates, there was a little bottom corner of it that said 12 to 17 or 12 to 18 didn't need to be vaccinated and they could participate in sports. So I was a little confused about that. I don't know if anybody has clarification on that.
Dr. Day, do you want to please just kind of clarify that again, that Dwight just asked a question in regards to the 12 to 17-year-olds?
Yeah, so in the vaccine certification program that will start next week, 12 to 17-year-olds who are in an organized sport do not require vaccination for the government certification process. However, what they are relying on is sports organizations to make those decisions to help protect their participants. And so we've seen, I mentioned hockey. A lot of hockey organizations have already gone this way. Some basketball organizations have. I fully understand that angst that you've talked about, for those who, if they don't get vaccinated, then they can't play. But we also have to think about, in order for them to play, to continue to play, vaccines will allow that. And I actually have some data looking at some of the outbreaks that we had over the summer, just over 1 month. Some were in Durham, some were in York, some were in Toronto, all basketball tournaments. And people who lived in Toronto, there were 9 cases, 65 people who were identified as high contacts. And of those 9 people, the average age was 17. 2 were fully vaccinated and 7 were unvaccinated. And so I think that's just a really good example, and then if you end up with a case on the team, the whole team then who's unvaccinated cannot play. So you'll be canceling games or canceling who are you going to play against, right? Whereas if you're vaccinated and you've been exposed, you can actually continue to play. Public health is allowing that. So I think that's also the point to consider, is that if you don't go ahead with vaccine requirements in some of these settings, they may be allowed the first week, the second week, but as we head into the 4th wave, the unvaccinated may be excluded because there is an outbreak. And so it will actually preserve the sport over the season.
Thank you, Dr. Dubé. Drew, go ahead, Drew. Go ahead. Thank you, Dr. Dubé.
So just to clarify, I want to make sure we heard correctly. So you're saying that if you're between 12 and 17 and you're vaccinated and you've been exposed, you can continue to play the sport. So that would mean that you wouldn't have to quarantine or anything like that. Is that what I heard?
So anyone who is vaccinated, if they were exposed to someone who was contagious, because they are fully vaccinated, so 2 doses, 2 weeks, more than 2 weeks since the last dose, they do not need to self-isolate at home for 10 days. This is a really important point, because it means in school, for extracurricular activities, if you're doing socializing, even like if you are exposed to someone, you do not then need to stay home and self-isolate for the 10 days. It used to be 14 days, now it's gone down to 10 days. If you're fully vaccinated, as long as you don't have symptoms. And so we're still going to recommend that people who are vaccinated and were in close contact get tested, because we still want to be able to make sure that we can detect the cases, but they will not be required to self-isolate at home.
Thank you so much, Dr. Dubé, for commenting. Yes, please, go right ahead. Thank you so much.
Yeah, I think one of the problems I have with the whole COVID and vaccine situation is like how the information is being given to us. Like, I would have never found 12 to 17 and if you're vaccinated you can still play. I've been looking for that. That's information I want to know ahead of time. Like, I think that there's a lot of information out there, but to find it you have to go through 22 pages and search through all these things, and like we don't have a lot of us, like me speaking from my age and my demographic, a lot of us don't spend the same time to look through research and go through things. It's just not what we want to do anymore. We live in an era where songs are 2 minutes and videos are 10 seconds. Like, I just want quick hitters. Like, if you are vaccinated and you are between this age or any age, you can play and continue to play. That's important information for me and RJ to know as we run our businesses with people who have to be vaccinated to play in these kind of things. Now we know, okay, I can have a tournament. This can happen. If they're asymptomatic, they can play. But where do you find information? Like, this was not emailed to us, because I'm on a lot of I have 6 facilities. And I'm on a lot of public health chains, and nowhere in there does it say if you are vaccinated, then you have this information and you can run with it and do that. Like, I get emails every day, believe me, emails and calls, and nowhere does it say that. It should be bold. It should be a headline. This is very important information, and if I didn't come here today, I would never know. So for me, I feel that's a little bit upsetting and like a short change, because in a week it means I could run a tournament. That means the CYBL can play. That means the kids can play again. But nobody knew. He was worrying about cutting kids and mental health. But if now you're telling kids, okay, you know what? Feel comfortable, get vaccinated, go ahead. And if asymptomatic can still play, that means that 17-year-old who's getting a look from a school who never thought he can go do and get educated, or her, anybody, can now pursue further education and work out and be a part of these things. But you're telling us today, and this has been coming out, I mean, however long this came out, and you know what I'm saying? Like, Dwight didn't know. I didn't know. It's just a shocker to me. I'm just a little bit shocked.
Yeah, no, Jay, thank you. And no, but thank you. And we're going to let Claude, like I said, this is why we do these town halls. This is why we come together. Claude, go ahead.
I have to be careful what I say because we're involved in legal and making sure information that's coming to us. So I'm not going to say too much. But what I will say to your comment, this is your business. You should know what just came out a couple days ago because you're a facility owner. This is my business. I knew moments after it came out because this is my livelihood. It's your livelihood. So you have to know, and that's the reason we have this event tonight, so the community cannot just say what you just said as a basketball facility owner. You're supposed to know when things come out because this is your business, because that allows people to be in your facility going forward as of basically 2 days ago. It's a serious problem we have in our community. We have to know the situation. This is your business. Is this what you do? You're supposed to know that. There's doctors in the room right now that are giving us good advice. You're supposed to seek those information out. We all have friends here who are doctors or nurses that we grew up with. Those are the people you should be calling because if you're not sure, if you don't trust next man, next lady, what you're saying. That's what I do. I went to school with many doctors. So when I have a question, I call them and ask them about the vaccine. What should I take? Because you have to trust somebody. We can't live in a society where we don't trust anybody. And the reality is you have to be informed. So I don't want to say much more.
Thank you for that. Claude, and again, I just want to, before everybody comments, just to sort of, because I know it's a heated topic, and I know everyone's kind of jumping on the mic. Like I said, I still want to keep some order here, so allow everybody kind of, get a chance to comment on it. So I think, Patrick, you want to say something towards that. Just one moment.
I'm gonna be on both sides, because I still think the common theme that we're having in this conversation is messaging and information. And Dwight sent something to me that I didn't know. I had to source out. But at the same time, the information's coming out. It's not coming out in a manner that is the same exact way. And I'll go back to when AIDS was very big. The messaging in terms of information flow all the time, every time. The resources to find people who are affluent, influencers, stars, They spent money on those things to do that. I think the same approach has to happen with a pandemic like this. Even though we own businesses, because we're fighting a reactionary system, I still think, and I'm going on both sides, you still source out. But the other thing is also at the same, on your side, is I'm trying to float. You guys just opened up 6 businesses during the pandemic. You're trying to survive in controversy, chaos, the whole nine, and still trying to provide a service for our kids that nobody else is providing. So we also have to be cognizant on both sides that I still think the common message is the messages is not coming out clearly. There's a discourse in now. We had a group of kids going to Montreal. We told all the parents that they got to get vaccinated. Then on September the 15th, Montreal law changes. You have to be double vaxxed and you have to be vaccinated 7 days before the event. So guess what? 4 of our kids can't go. Then the next day, Ontario says, you don't have to be vaccinated. 2 of those parents were staunch against it. So I think the messaging from the bottom, but also the top, is confusing. As a country, you have to have a united approach. You can't fight a pandemic when each province has its own rules. So if each province has its own rules, then you go across the border, they have their own rules. And then certain states have their own rules. So we can't complain about, per se, businesses not knowing. We don't even know what the hell we're doing half of the time, because the government is literally giving conflicting information according to how far you drive geographically, 3 to 4 hours.
Yeah, and again, this is why we have this. Dwight, go ahead.
People blame the mass media for a lot of stuff, but think about it. What I find is a lot of stuff I get sent on WhatsApp, people say, oh, that's shared like 30 million times across the planet, and it's foolishness. CNN only has 3 million viewers. That misinformation is the mass media now, and it's killing people. That is the mass media. You will see that WhatsApp video more than you're going to see, Anderson Cooper on CNN. 30 million people for this, and it's just complete, just some guy in his basement talking, but real information that's been checked that the public will see and can, if I get something wrong on the news, dude, I don't have to wait till the show's over. They're tweeting at me, hey boy, what did you just say? That's wrong, right? But this guy in his basement and people are listening to him, and I can't wrap my head around it that, it's so important that we have to make sure the sources that we go to are legitimate. But Patrick makes a really good point that we do have to get a better job of getting info out. So when you get in the car, turn on 680 News, man.
I'm gonna give Jade. You wanna defend yourself a little bit, because I know you I feel like I got beat up a little bit. Go ahead.
I wouldn't say defend myself. I just feel like if, as a community, we're all doing the same thing. So if there's something that Drew knows that I don't know, we speak. Something that Patrick knows that I know, we speak. So if you're, and this is for everybody, this is not for anyone specifically. Like, if you have information ahead of time, and it can be shared amongst all of us, we should just share it. There shouldn't be a time like, if I'm confused or Chippy's confused about something, then it shouldn't be like, well, you should have known. It should have been like, oh, I should have shared it with you. That's how I feel about the situation. Information should have been shared. Like, I'm 29. I don't know much doctors in Toronto. I'm sorry. Like, I apologize that my friends aren't doctors, but I know a lot of people who are in the industry. I can ask a lot of other questions about business, about staffing, about operations that some people couldn't answer. But if you ask me a question about that, I can gladly help. And if you something that you know ahead of time, then just share the information. I mean, I'm not the only one confused about this. As you see, the whole side it's not just me. I know I have the facility, I understand that, but for him to run his program he had to know too. This had to come down from somewhere. So if anybody had the connection already, just share it. There's no need to be like, no, you should have known already. That's not the way we're gonna get past, because this is how information stays in your circle. They don't want to share anymore. Like, why would I want to tell anything? No, I'm just saying, like, if there's a way you could find that information, if you don't want to tell me, be like, hey, this is what you can do. We're posting all these things. We're opening and we're good to do this and we're good to do that. But no one is sharing the deep depth. That's what I'm saying. When I saw the clip, I saw 12 to 17 does not have to play anymore. I didn't see anything else in bold writing saying, if you're vaccinated, you can continue to play. That's all I'm saying. That one part was missing. And if we, as a community, knew, I think a lot of our answers or a lot of our questions to this would have been different. He would never been questioning cutting a kid or holding off on a tournament.
That's right. Thank you so much, Jan. That's why, again, we have our health professionals here with us. Exactly. This is why we do this. And we hope that, we continue to support it. I think we're going to go to Tamira online. She wants to make a comment as well, too.
I do. Sorry, I don't know his name in the white shirt. But I feel for him, because a lot of the information, a lot of people don't know. Like I said, I work at Scarborough Health Network as well, at the vaccine clinic and the assessment center. And a lot of the times we're doing our education at the assessment center. We give them the paper, but no one's reading it. So the nurses in that moment is trying to give them as much information as possible. And I find that the information on the government website is a lot, because we get emailed it a lot as well. And it's a lot to read through. And I feel they need to make it more user-friendly and easy access. They keep saying going to the website. A lot of people don't have access to internet. And I only realized this, like, to my core when we went into lockdown, that a lot of families didn't have, computers and these things. So I think the conversation needs to go in, how do we educate our people and how we get the information to each other, just like, I'm sorry, I don't know your name, the gentleman in the white polo shirt, how we get the information to our people so they're better able to educate themselves and not feel attacked in any way. We're here for you. And I wish I could sometimes just spread the information that I know to you guys, honest to God, because like there's so much information out there, but it's a lot to read. And no one's sitting there, like you said, it's a 10-second video. There needs to be better PR. There needs to be better commercials. Like, just, even if it's just a quick, like, OHIP Plus. A lot of people don't even know about OHIP Plus. Like, a commercial that just tells families what OHIP Plus is. Like, those little things, I think, is what we need to be using some of this money that's coming in that we're being told about, to educate our community in ways that we can reach them through the radio, through commercials. Those are the ways that we need to do it, social media. So I think I feel for you. I like hearing you not knowing that breaks my heart, honest to God, because that's been out for a while. So.
Thank you, Tamira. Lua?
Wanting to add to my experience. So in the months that I was entrenched in vaccine work and COVID work, I literally lived, breathed, slept, ate it. I'm not kidding, would dream about vaccination clinics, like, or have nightmares about vaccination. And my colleagues in the room here can, we all shared our stories of the nightmares we had when we started the next day at the vaccination clinic, because we were so entrenched and day in, day out, like this was our focus. And so, but even saying that, there were moments when I was still confused, or when I still didn't have the most current information, or we're in a pandemic where information is changing so rapidly. We're learning new things hourly, daily. I think it's just to acknowledge that this has not been an easy time to try and navigate through how to survive COVID, how to exist, how to navigate, how to normalize our days, how to make sure that we're still staying healthy as our community. So wanting to acknowledge that it's not an easy task. And I know it was said earlier around having people that look like us at the table. And I think even around messaging, I think even more so around communication, that's so important, because we are the ones who know, you're the ones who know what'll resonate most amongst your brothers, your sisters, your family, your community. When it comes to messaging, that's either if it's a video clip or Twitter posts or Instagram posts or TikTok videos, like I think we need to be at those tables. We need more of those sound bites. We need more of those, the information traveling in ways that is easily digestible. We need to be at those tables also informing how that messaging is created. But I just wanted to acknowledge that this has not been an easy time. And I think it'll only continue as we learn more about the pandemic. Policies will only continue to change, mandates will only continue to change. And it's on us, to your point, to work together as a community to try and find those solutions and support each other through it. And just really acknowledging that it hasn't been an easy road. Don't anticipate it will be, but I think we can do it and we can make it. And I'm so grateful for the time and the space in this room to have these conversations. I think having safe spaces for these conversations is so important.
All right. Thank you, Philon. Dr. Dubé, you want to comment? Dr. Dubé, you want to go ahead and comment, please?
Well, I just want to say that I am in public health and find keeping up with the information challenging as well too. So I do really want to acknowledge that. I can just say, I posted in the chat, you probably can't see it, but the province has a Stop the Spread business information line. So there is a number. Toronto Public Health has a hotline, and I do want you to know that I actually work with our team at Toronto Public Health to have the information updated on our website as it comes in. Like maybe just follow us on Twitter. We actually have Instagram though, anyways, but it's kind of hard to follow these organizations. I really understand that, but the information's always changing. I think we got to leave it to Dwight then, and you're just gonna have to watch him on the news, and he's gonna have to be our update every day.
Thank you so much, Dr. Dubé. Go ahead, RJ.
So I'm gonna come from a different angle. I deal with a lot of like older men in leagues, not necessarily a lot of children's. So now that we have identified, there's a lot of misinformation, there's a lot of miscommunication in terms of the information being shared. I bet I'm gonna go tonight to the gym and have this guy ask me all kinds of questions that I can always just send them links to and stuff. But I guess the best approach, the question I have is, what's the best approach to communicate with our community to say, I just found this, like, what platform are we using to share this information aside from the government sites that people can easily access to? Because the government site's up there, but not everybody wants to read through all the documents. I'll read through it, but my player who just is very concerned about first being, informed about the vaccination itself, and then the second part of it being, misinformed about the enforcement of this whole passport thing coming out. Where do we find that, common ground of decent information we could share? And not to say that Toronto Public Health isn't doing a good job, but again, how can we better communicate this stuff, and what's the best strategy towards that?
Yeah, great. We love that. Great. Absolutely.
I think one of the things we were speaking about in coming out of the last meeting and prior to that, which I think public health and probably some of these organizations could put our heads together. I think for me, being an organizer, but also working in a school, but also being a community advocate, I want the powers that be who understand this to a science to help us with governance, meaning how to be COVID safe in basketball. It's such a blanket approach. Okay, that works in hockey, that might work in lacrosse, but I'm in a basketball setting, have a basketball game going on. Give me from A to Z how you as a public health or as a policymaker would make this happen. I think that's what, if I'm asking for anything, I want the experts to do it. I don't want to sit there try to figure it out, and then you come and give me a bylaw ticket or shut us down for. Give us that total support, like how hockey got governance help, lacrosse got governance help. We have to look at, for me, as a person of color, we're always begging for something. Give us the same support. So I think if there's governance that's needed to be done, you're complaining about the pandemics and the super spreaders. That should mean that we are trying our best, but we're not experts at it. Put some of that money into the supports so we can now make sure that we're on the same level as hockey, baseball, soccer. And I think that's, for me, it still flows right back again to it. And you just said that. Messaging. That's part of the messaging. Teaching us how to do it right instead of complaining about that we're doing it wrong. That's just my 2 cents in it.
Thank you for that, Patrick. Yes, I know that Claude.
The purpose of me being here 2 weeks ago and after that meeting was to meet with the 3 doctors right here and Dr. Allen to do just what you just said. Ontario Basketball has an obligation, I believe, to do what you just said. You don't have to do it, but we're going to do it. Because not all of us for my members, for the basketball community at large. So what I want to prepare is a document that's easy to access for attendees, facility owners, and event planners. So there's no more excuses in the community of why things are wrong. It's a quick sheet, it's 1 page. Maybe those Instagram things I see now is like 1 page, 2, 3, 4, and public health, signing off on that. So when this is over, we're gonna speak, the 3 of us and Dr. Allen, to get this ready soon.
That's right. And I must admit, let me just comment on that. Yes.
I'm gonna say this, I don't like the long talk. This is great conversation. This is great conversation, but for me, it's too much. It's too much conversation for me. We know what to do. That's a key thing, and move on. Because people's businesses are being hurt, their money's being hurt, kids can't play, a lot of things that we know should get done. We're having all these conversations, it shouldn't be the next 2 weeks and we have another conversation. It needs to get done quickly and get out to the masses so we can do things properly going forward.
Thank you for that, Claude.
OHL just said, if you're not vaccinated, you can't play. There wasn't any reason. They didn't give any rules. They said, listen, if you want to play hockey, go get vaccinated. So you're trying to be nuanced and involve everybody, but I think the other organizations just said, that's the rule. That's it.
This is a bigger conversation because unfortunately in the society we live in, there's litigation. And it's not talked about, I won't even go there right now, but it's bigger than just sport. If someone gets hurt to sport, what's gonna happen to that person? If you mandate people have to do certain things, what's gonna happen in human rights litigation? So this is a conversation that no one's talking about. I don't think we should go there right now, but that's why sports are waiting. They're waiting on the government. The government has now done something concrete to take the liability away from clubs, from my organization.
So you have protocols to follow.
So there's protocols. So many sports, hockey came out first. They're not happy right now because they've kind of jumped the gun, and now the government's kind of said, oh, well, youth sports, which 2 weeks ago, you know what that was. Youth sports apparently now is 18 under. Right? So it's a fluid situation. It's a fluid situation, but it is what it is, and that's it.
Thank you for that, Claude. And let me just be an advocate for you because you certainly have been pushing and trying to get the answers. I know that
I'm very
for
impatient.
sure.
I'm very
You've
impatient.
been pushing.
I
No, he's been
like to-
seeking and searching
So-
for those answers. I know
I
that.
was on these guys very hard, but it was a long weekend, so these guys are great at what they do, and I respect what they do, and I have confidence in what they do, because what they're saying to me, I've been hearing. And this is a big conversation. We got to talk about this because the CNN, Fox stuff, it's political. It's political. You watch certain channel, you hear this. You watch certain channel, you hear this. And unfortunately, we live in Canada, but we see those news sources. And
Jason Kenney played politics, and now he's a politician.
right, so now we have to go back and figure stuff out, you know. But at the end of the day, the information that you just asked for, Patrick, should be coming shortly.
Yeah, thank you.
Can I-
Dr. Allen?
Just real quick, I'm just thinking with the help of public health, because if there's
So
have them involved.
It's the attendees, it's the business owners, facility owners, and the organizers. But it's being by doctors and public health. That's what I'm saying.
Can I throw some gas on the fire? And you would probably be able to answer. After the super spreader event, or like all the events that they said were related to basketball, right? I'm gonna just throw a little bit of gas. Was anybody ever approached by Toronto Public Health or governance to assist in preventing these types of events?
Yes, I was spoken to. I was called.
Okay.
Yeah.
Thank you. Dr. Allen? Let's go to Dr. Allen.
It's really quick, Claude. I know you're a man of no long talking. So do you think that basketball is going to jump on the what OHL hockey did, and make it mandatory? You know,
The basketball will come out with their ruling very shortly. Very shortly.
So again, then that means that the OBA is going to dictate what happens with what's happening. Like can you repeat again how?
The government, the OBA does not. We're a PCO, which is a public sports organization. We're not dictating anything.
Okay.
We'll follow what the government asks us to do.
And then whoever else is running basketball is gonna jump on that.
Well, each organization can do what they want to do. But as a PSO, we're going to follow the government guidelines.
Also, set that standard and you're okay. I like that.
There's nothing standard. There's just not dictatorship. People can do what they choose to do, but most sports organizations are going to follow what the government says to do.
I just want to add to just the messaging thing. We have a pretty large platform, obviously, with basketball. I think the government has to really get on the ground. You can't sit in the ivory tower and make these calls. They have to reach out to people like On Point, Hoop Dreams, Motion Basketball, Yace, Grassroots, Jane and Finch, Mega City. They have to now care about our community because our community cares. And I think when you put out in the media that, there's an event and all these cases and nothing's really proven, all right, you cannot really pinpoint and say this many cases came from the event. But you are looking, but you're also tarring the whole community. So what I'm saying is, get on the grassroots with us. Speak to the people that can actually get that message out. And it could be through Instagram. It could be TikTok. We do posts all the time. It could be Facebook, Twitter. I think we can put it together, even like a 10 slide, up to a 10 slide, or we can do continuous information over the next 2-3 weeks that has the information, the correct information that people can digest. All right. And when there's new information, reach out to all these organizations here. As soon as that new information comes out, every one of us gets an email. Please, this is new information that's come out. Get it to the community. I think everybody here can be a beacon. And as Dr. Redmond said, we are powerful. And so we have to realize our power. All right. But we also need the support from the government and we need the support from the medical community.
Thank you for that, Drew. I think Jamie wants to make a quick comment. Jamie? Or Dr. Allen? Who wants to? Dr. Allen? Go ahead, Dr. Allen, please.
Sorry, what did you want me to comment on, Martin?
Oh, I guess they're just looking for some guidance as to, how to allow us to kind of get the information to the community, get governance, just to, give some guidlines that we can
Yeah,
sort of
well,
try to adhere to.
I think there are two
the
things.
basketball organization.
I do agree 100% with what Patrick said earlier. I think that we and this ties in with some of what Claude said, I believe. So we need to work with some of the powers that be to have some overarching policy guidance that is shared with you all as leaders. That's one thing on the policy side. The second is on the information side. On the science side is what I spoke about earlier. There still are a bunch of questions that we can actually answer for you. So there's a science and then there's a policy. But the next thing that we need to do, which is so important, is that, and I hear this from many people, there's a lot of information out there. The trouble is that somebody needs to tell you that the information exists so you can go and find it. So part of what I think needs to come out of this panel discussion tonight is this document with the science something with the policy, and also where you can go to get additional information. Because, somebody has to tell you where to go to get information. If not, you just won't access information because you don't know.
Okay, thank you, Dr. Allen. So again, back to what Drew was saying, I think that it's important that as a community, even though, like you said, the government sets their guidelines and their rules, it's important for us to educate each other, to continue to hold in unity, hand in hand, so that way we can make it through these challenges. And so I just want to go back to what you're saying. And so, of course, there's that information, but who is going to sometimes interpret information and give it to us in the way that we can understand and we can apply to our everyday lives and to our families and friends and organizations. And I think that's important. So I'm sure we're going to all keep working on that. And as we continue to do these events, this is the reason why we do it. This is why Black Creek decides to put on these events. That way we can sort of come together as a community and take care of each other, right? And so, we have honored guests. So go ahead, Luam, if you want to make a comment.
Just to add to Dr. Allen's points, agreeing, but also to say that in addition to the policy and in addition to the documents that reference the science, I think what I'm hearing is there's also some anxieties or some concerns around how that is then communicated to the individuals that you're that are on your teams, that are playing in your facilities, and their families. So I think there's a lot around knowledge transfer, and I think through every pandemic we haven't really gotten knowledge transfer right off the bat. Like, I think there's always going to be gaps between science and how that information gets disseminated in a way that is easily digestible and understood by the general public. We're in that now as well. But I think this one more piece to add is, in addition to the policy, it's also what tools and resources you can use to share amongst your respective communities, your teams, your facilities, the folks who are coming there, so that it reinforces why the policy is in place to begin with. Because I think that's what I'm hearing in the conversation today, is also how is that communicated with the people that you are interacting with through your businesses and the people that you're hoping to support who can come and play safely in your spaces.
Thank you for that, Luam. Well, I think in a few minutes here, we're going to just open up just an online question. This is going to go to Dr. Dubé. So Dr. Dubé, the question that we have, and this is coming from our online community, they're asking, I guess, what's better or what's the difference between having natural immunity, like actually getting COVID and recovering, versus them getting the vaccine?
Okay, sure. Yeah, those are great questions. Actually, before I jump into that, I just want to say that at Toronto Public Health, we're actually working on resources like a toolkit for sports organizations on this policy on vaccinations. We have a toolkit for workplaces, and you're all employers, I would imagine, so you can actually look to our website there. But to provide guidance, and really what we're going to recommend is, whether it's arts or sports or whatever kind of organization you have, that you develop a vaccination policy. And a vaccination policy can be something as simple as just knowing who is vaccinated, so that if there is an exposure, someone is contagious, you know that the vaccinated people can stay and the unvaccinated people have to isolate. It could be as simple as that, to the point of requiring vaccination. So just to get you started thinking about that, and hopefully we'll be in a position to post that next week and can absolutely share that with you. Okay, so now to the question on natural immunity. I want you to know that actually in the guidance now, if you have had COVID within the last 90 days, you will be considered like a vaccinated individual, in the sense that you will not have to self-isolate if you are exposed. So that's COVID in the last 90 days and we're cleared, then you don't have to self-isolate. But it's only for 90 days because we know that natural infection doesn't last. I mean, COVID is like a cold virus, and you can get the cold more than once in a season. And so that's why we still recommend that you get vaccinated to get that longer term protection.
Thank you so much, Dr. Dubé, for commenting on that. Well, we are winding down here to the last minute of our wonderful town hall, Locker 2.0. I know that we're planning to do some more of these meetings, because I can see that it is well utilized and well needed in our community. So I want to thank each and every one of you for your honesty, for being here with us. We appreciate the commitment to the community. Thank you to the doctors, You're the guiding light for us here during this pandemic. We salute you. Thank you to Black Creek Community Health Center for hosting this event, and to the Jamaican Canadian Association for the use of your space for this live broadcast. Thank you, everyone, and good night.
How do you feel, man?
Can you believe it? Listen.
It's done?